Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for bronchitis. What is bronchitis? Inflammation of inner walls of bronchi of lungs is called bronchitis. What are the symptoms of bronchitis? Incessant cough, whizzing in chest, foamy saliva, low fever, chill, breathing troubles, weariness. What are its types? There are two types, acute and chronic. On the right hand side, the inflamed swollen bronchus actually has been demonstrated. See this is a healthy bronchus. This is healthy bronchus, this is an inflamed bronchus. Look, the lumen has been almost clogged with the inflammatory fluids inflammatory excretion with the fluids. It is almost blocked, and this is the reasons for trouble. Here, actually bronchus starts with first trachea, which is trachea, then primary bronchus, then secondary, then tertiary, then bronchioles. Ultimately, bronchioles also divided, and finally it is end in alveolar sac. When the alveolar sacs are filled up with excretory fluid, it is called pneumonia. That is the ultimate. It is intermediate disease, bronchitis. What are the reasons of bronchitis? Number one, microbes, bacteria, virus, fungus. Number two, smoke, polluted air, direct, indirect smoking, automated transports. Actually, the fumes excreted by that transport, factories. Number three, professional environmental chemicals. Number four, asthma or allergy. These are the common bacteria: Streptococcus pneumoniae, Mycoplasma pneumoniae, Haemophilus influenzae. These are the common things. But mind it, 90% of the reasons are in smoking. Smoking, direct or indirect. Which type of bronchitis is dangerous and why? Chronic bronchitis is the most dangerous. It is defined as if a person suffers 3 months in a year and consecutively for 2 years, then he is a patient of chronic bronchitis. Bronchitis this converted into chronic bronchitis, then emphysema. Look this, I am reading this flow line. Bronchitis, chronic bronchitis, emphysema, COPD. Actually, COPD, you know, chronic obstructive pulmonary disease. These are actually two forms. One is emphysema, another is asthma, bronchiectasis. These are actually all collectively called COPD. Here, this has been shown here how this is the pathology. The normal alveoli looks like this. When it is emphysema, the alveolar elasticity is completely lost. They are fully swollen and remain in the swollen stage. There is no swelling and compression. Actually, this swelling and compression, this alveolar swelling and alveolar compression is the most normal thing by which air enters in the alveoli. Interexchange of gas occurs. But when the elasticity is lost, they are in a state of inflated state completely, and that is very dangerous. The patient feels very much trouble when these are inflamed. In emphysema, this is the condition. The emphysema, the whole lung is filled up with air. The black sign means air. This is bronchitis. Inflammation of bronchus. This is in bronchus picture. How to prevent bronchitis? Number one, stop smoking, avoid indirect smoking. Wash hands often, wear mask. In cough and cold, take rest. Do not take any medicine unless needed really. Take healthy foods and drinks. Get annual flu vaccine. Stop other addictions. Take physical exercise daily. Get solid sleep 6 to 7 hours daily. Mind you, these are preventive management, but these are very, very important for continuation of health. Now, remedies. Sulfur for bronchitis. Inverted bronchitis, chronic catarrh of long standing with large quantities of tenacious mucus from thickened lining membrane. This is thickened lining membrane of the bronchus. Suffocation with palpitations, cough with nausea and vomiting, heaviness of head with dim vision, sensation of an ice in chest whenever chilled or perspiration is checked. Mind this. Sensation of an ice in chest whenever chilled or perspiration is checked. This is an USP. USP actually uncommon, strange, peculiar symptom. A symptom that doesn't normally corroborate the pathology. Silesia for bronchitis. Bronchial affections of brachytic children. Obstinate cough provoked by cold drinks with copious transparent and purulent expectoration. Pains, soreness and weakness of chest relieved by inhaling moist warm air. Loss of breath when lying on the bed or stooping. Expectoration of pus, which when thrown into water falls to the bottom and spreads like a heavy sediment. Phosphorus for bronchitis. Subacute bronchitis in emaciated cachectic or young overgrown invalid. Dry tickling cough in evening with tightness across chest and expectoration in the morning. Pain in chest during cough, better from external pressure. Trembling whole body during cough, worse from presence of other persons. Bronchopulmonary catarrh from dilatation of fatty degeneration of heart. Here heart and lungs or other respiratory organs conjointly creates this trouble. Nitrium mure for bronchitis. Dry cough from tickling in throat or pit of stomach, day and night. Lungs feel raw, sore from continued cough. Headache from coughing as if it would burst. Stitches in the chest when taking long breath. Coughing with involuntary spurt of urine. Important symptom. Cough from empty deglutition with vomiting of food. Sputa, viscid, transparent, worse at seashore. Hateful to person who offended him, hates, consolation, fuss, reserve, and lachrymose. The last line is the general symptom that characterizes the person. That is a very important symptom. Kalikar for bronchitis. Incessant hard retching futile cough followed by vomiting, stabbing pain in chest, whole chest sensitive, coldness in chest during cough, small balls of mucus spurt out of mouth involuntarily. This peculiar symptom the patient cannot know when and how these small balls of mucus spurted from his or her mouth. Sputa thick, bloody, salty, yellowish, greenish, offensive, profuse. Taste a salty, pungent, sour. Very irritable, never contented, fear of future, death, ghosts, hypersensitive to all external stimuli. This symptom is returns to the person in general. That is very important symptom. It characterizes the person. The person is important in homeopathy, not the other common symptoms. Kali bichromicum for bronchitis. Bronchitis oscillating between acute and inveterate form with moderate mucopurulent stingy discharges, often along with periosteal or rheumatic pain. See this thing. This bronchitis along with periosteal or rheumatic pain, burning sensation in trachea bronchi, expectoration difficult, worse in winter, chilly summer days, gets up in bed to breathe, better from bending forward, spitting out of sputa, adapted to syphilitic or scrofulous persons, indifferent, indolent, suffers from anthrophobia. Anthrophobia means person who is anxious about other persons. They cannot tolerate gathering or multiple person around him. This is some sort of feeling of fear. That is called phobia, false fear, anthrophobia. Fear from persons, different persons. Pepper salt for bronchitis, mostly indicated when cough enter the stage of resolution. Cough enters into the stage of resolution, rattling, choking, moist cough. Worse during morning and after eating. Cough as soon as patient uncovers any part of the body. Sputa, dirty, yellow, fetid. Patients fly into anger at trifles. When angry, can murder, set fire to anything, do any dangerous action. This is the characteristic of the versatile patient. This is most important point. This is relates to person, not any particular disease. Causticum for bronchitis. Tremendous racking cough, especially at night with pain at throat, head. Patient cannot throw sputa out, swallows it. Sputa tastes greasy, cough after getting warm in bed, cough with pain in hip. This is an USP. Cough, cough with pain in hip. Pain feeling in the hip due to cough, during cough. This is uncommon, strange, peculiar symptom. With spotting of urine, natrium. Spotting of urine is not abnormal symptom. This is available in many other medicines also. Medicine also, such as natrium. Cough relieved instantly by a sip of cold water. Weakness of lower extremities, morning hoarseness. Patient oversympathetic, concern-stricken, hopeless, reticent and pessimistic. This is relates to the person. Antidote for bronchitis. Bronchitis of infants and old ones. Excessive secretion with little power of expulsion. Rattling in chest with increased irritability to cough. Sudden alarming symptoms with oppression and orthopnea. Orthopnea is breathing trouble. So that patient has to sit up in bed with fits of suffocation in morning and evening. Tendency to diarrhea and patient is hopeless, despondent. This is general symptom. Relates to the persons. Among card for bronchitis, bronchitis of the aged person starting in winter continue till summer heat prevails. Profuse bronchial secretion with great difficulty of expectoration and bronchial dilatation. Excessive coarse rattles, yet patient requires no necessity to clear out the chest. That is, somewhat he is okay with that rattling sound. Worse, after eating, talking in open air, on lying down, followed by exhaustion, low vitality and atonia of bronchial tubes favoring emphysema. That is, this patient very soon turns from a bronchitic patient to an emphysematic patient. Emphysema is a far more serious and dangerous disease compared to bronchitis. Patient's mind vacant, loss of memory, depressed, general symptom. With this, the video ends. Thanks for listening and viewing. If you got anything to say, please write down in the comment section. I will certainly reply.